Hello, I'm Solome Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Stephanie Strong here with us, founder and CEO of Boulder Care. Welcome, Stephanie.
Thank you so much, Solome. It's great to be here.
Well, it's great to have you back for another year. For the folks that aren't quite familiar with Boulder Care, can you give us a brief intro?
Absolutely. So Boulder Care is a digital provider of treatment for substance use disorders. Through telemedicine, our own mobile platform, we treat patients with comprehensive substance use treatment, including medications, through very experienced clinicians, as well as supports like peer recovery coaching, in order to help offer long-term support and outcomes for people with opioid or alcohol use disorders. So our teams work collaboratively to anywhere people are, reach them with clinical care, medications like buprenorphine that are incredibly evidence-based for treating this condition, but very difficult to access, as well as other care team members who work in a very coordinated way, care advocates, to eliminate a number of barriers from insurance issues to pharmacy delays to make sure people have reliable access to medication and can focus on their recovery. And our certified peer coaches who have lived experience in addictive disease and with empathy help support our patients through motivational interviewing, recovery capital, and brokering to local resources like housing or other meetings, social supports. So Boulder was founded in 2017, and since then I've treated hundreds of patients on our platform, partnered with both public and private health plans all over the country, and are excited to share more about what we've learned in the last several years in building our treatment model.
Well, this last year has been quite the eventful one, particularly in the substance use space. Can you talk about any new developments that are really top of mind for you?
It has been quite a year since we last connected, early when the pandemic was just beginning to impact our country. And COVID-19 really brought the entire country into public health crisis mode. So it forced us to ask, how do we move fast and minimize harm and save lives? And that fundamentally is what Boulder was built to do. So policymakers, payers, traditional providers, and innovators really came together over this last year, recognizing that if we don't break down barriers to deliver critical services at scale, the impact on human lives will be catastrophic. And although there was a very kind of record high level overdose rate in this past year, over 90,000 lives lost, we know that without some of these changes, things could have been so much worse. So on a policy level, you may recall, we talked last year about the sweeping changes to things like the policies that required an in-person visit before starting telemedicine treatment for substance use disorder, as well as relaxed guidelines for expanding clinical care across state lines, while licensure requirements have historically been very strict to limit access. And we're hopeful that many of these barriers will remain lifted long after the pandemic. And we know that the aftermath will be something we all need to think about as behavioral health providers.
Speaking of new developments, what other exciting policy changes have happened and how has Boulder adapted?
It's been pretty incredible to see other new entrants and policymakers and regulators focused on expanding access to substance use disorder treatment through telehealth. And we've been working very closely, including in our state, our headquartered state in Oregon, where we've been the first state in the country to decriminalize small amounts of possession of all drugs, a really progressive direction that is showing a commitment to investing in treatment as a public health concern, as opposed to criminal justice or incarceration. So Boulder has played a major role in the state, partnering with the criminal justice system to treat patients who are incarcerated. Through telemedicine, we can reach them with medication and support their reentry back into the community. A really fragile time where we know the overdose rate is up to 100 times higher than for the average individual. And make sure that someone has a safe ride home, a peer coach assigned to them to help them through similar lived experience, a prescription, and regardless of whether they're Medicaid or other benefits have been reinstated, ensuring no disruption to their care. So we're very excited to be kind of pioneering this in Oregon and expect that this can be a model for the rest of the country to emulate.
Wow, what an exciting initiative and clearly very needed. Last year, you shared a bit about your partnership alongside Primera. Since then, can you talk a little bit more about additional payer partnerships and really how value-based care plays a role in all of this?
Absolutely. We're very proud to maintain our relationship with Primera going into another year of contracting with over 700 employer accounts, making Boulder available as an in-network benefit all over the country. And to now have a wonderful model to replicate with other Blues plans, like Regents Blue Cross. We recently announced a partnership in Oregon, Washington, Idaho, and Utah. And soon we'll be announcing another Blues plan relationship we're very excited about, bringing us further into new geographies. We've also worked closely with Medicaid plans in several states, and about 60% of our patient panel today are covered by Medicaid benefits. Some of the most underserved and folks who really benefit from substance use treatment and some of the wraparound services to help with things like reemployment or getting their driver's license back. So it's a wonderful way to make sure that those who can't afford to get care out of pocket or for whom rehab and expensive facilities are out of reach have great care. And our commitment to value-based pricing is a way that we can all kind of link arms to do that. Health plans have been paying for pretty low quality services or kind of seeing the impact of out-of-network balanced billing when someone goes to a rehab facility that is out of network without great clinical outcomes. So by partnering with health plans to make sure that patients are getting into the right care for them, evidence-based support that includes medication and long-term care management rather than a 30 or 90-day stint without any real follow-up for this chronic condition. And we all benefit when patients get well. So by putting our services into kind of bundled rates and looking at pay for performance or risk sharing over time, we all stand to gain from the thousands of dollars per patient per year for untreated opioid use and its really harmful consequences.
Right. And you're alluding to something else that's important for payers, or it just seems to be that I hear all the time, which is return on investment. So can you talk a bit about how does Boulder make the financial business case to payers?
This is a really important one, I think, for all digital health and behavioral health innovators. We've now gotten to a stage where there's such a proliferation of new providers and vendors that I think our partners on the payer or employer side are really looking for outcomes and to understand how their investment is going to be beneficial. And so that is where value-based pricing, I think, plays a big role. The fact that with a health plan, Boulder is committed to sharing in savings. So the cost of untreated opioid use disorder for an individual is up to 550% more expensive than the average member. And by getting them into low-cost home-based telemedicine care, we can really reduce that while improving their quality of life. Similarly, with employers, rather than asking for a PMPM or anything upfront in terms of contract value, we really look to be partners and say only for those who are utilizing these services will we be requesting payment, and we want to provide all the reporting and analytics needed to show what the return on that investment is. So here are just a few of Boulder's outcomes that our teams have generated and we're so proud of. A 91 Net Promoter Score, indicating that we're providing really quality care and satisfying the people we care for, which is our greatest mission. 80% 12-month retention. This is an important one. If you look at this curve, the typical status quo for addiction treatment is 30 to 40%. We see drop off early in treatment when policies are rigid and commuting to an in-person treatment center can be really challenging, as well as over time when we know that the longer someone is in care taking medication, the better they do. Retention results in things like a 50% decrease in all-cause mortality, ED utilization dropping by 85% or more, similar trends in hospitalization and length of stay. So this is a really good proxy for cost savings and reductions in total cost of care. That Boulder is over double the industry standard on retention. And another final outcome to report on, important for anyone getting medication for addiction, is that we are able to get same-day appointments and aim for within 24 to 48 hours to make sure someone has a prescription. This keeps people safe and is a really great benefit of a digital provider who can see someone anywhere they are, including in rural corners of the country where they may not have access.
That's really exciting results. Thanks for sharing. If we could talk a little bit more about Boulder specifically, I know there have been some new developments in your service offering and your growth. I'd love to hear more about that. Maybe we start with the service offering.
Absolutely. We've got an incredible team of addiction medicine specialists, folks who have worked in this field for decades. And so from day one, we knew it was very important to be looking at the whole person, and that addiction very rarely is only with one substance or from one path. So we have expanded into treating alcohol use disorder as a primary diagnosis. And about 40% of our patients do have polychronic substance use, which is sort of the norm. So adding features like contingency management, monitoring and oversight, expanding the medications that we prescribe, and building very robust partnerships with other medical and behavioral health specialists for care coordination has been our focus in improving overall quality of our model. We also are developing some special programs to focus on populations we've been caring for, like women who are pregnant in recovery, really robust perinatal care, and women's health specialist on our team. And I mentioned our criminal justice work, which has brought some really phenomenal people to our team, including a former parole officer and other peer coaches who have very long-term experience in criminal justice or have been in the system themselves to help with things like child custody or advocacy. And so we think expanding our ecosystem and developing these specialized programs are things that we're very excited about as we expand the model.
That's really wonderful. Great to have the representation on your team, which sounds like it's growing, and with that growth, more funding.
That's right. I think we've tripled the size of the team since we last caught up, and truly phenomenal people, all really dedicated to our mission. And I've now raised about 20 million to date from venture investors and received $1.5 million grant from the National Institute of Drug Abuse as well to continue our work, and partnered with OHSU in Oregon on a study that will help show, I believe the first of its kind since COVID, the paths of patients who go to traditional treatment as usual versus to Boulder for telemedicine treatment over a longitudinal kind of 6 to 12 month study period.
So you mentioned employers through your health plan partnerships. Can you talk a little bit more about what needs voicing from the employer's perspective?
It's one of the most exciting aspects of many of our health plan partnerships, and now directly with several employers, is that we can help co-create programs to help plans support their largest accounts and fill a huge need that's become top of mind for all employers in this really challenging time where mental health and substance use risk is higher than ever. So being able, as a private provider, to partner with health plans and employers in the messaging and communications campaigns that let people know, your employer cares about you, and this is completely private and stigma-free. If you wish to seek treatment, your health plan will cover it. And for you and your dependents, there is a way to get treatment without leaving work or going away to a rehab facility. So that's been really rewarding. And the fact that there's so much to gain for an employer by making sure recovery is possible for their employees is something really exciting. About 75% of people with SUD are in the workforce and employed. And those with SUD untreated miss more than 50% days than their peers. But one of my favorite statistics is that workers in recovery who report receiving SUD treatment miss the fewest days and are the longest retained of any group, including the general workforce. So the productivity and the trust and loyalty built by helping someone get well through their employer-based insurance is an amazing shared opportunity.
Lots of amazing traction with Boulder. Clearly, your growth has been rapid in the past year, lots of exciting partnerships, but there's also a lot of activity happening in the substance use startup space. Can you tell us what is uniquely different about Boulder?
There has been so much activity in our sector and in behavioral health more broadly, which I think is wonderful. This rising tide lifts all ships. And there's no one winner in developing solutions for recovery when there are millions of people who need care and the gap is just growing. But at Boulder, we're excited for a time when we can compete based on outcomes and are giving patients every choice to seek treatment with digital providers, brick and mortar, or some combination based on the experience that is best for them. So in terms of differentiation, there are some core things that we've been focused on as a company from the beginning. One of those is just being grounded in value-based care and in reforming payment structures for better outcomes. So by partnering with health plans, both Medicaid and commercial plans, and building a model that really takes the kind of analytics and a data-driven approach to bring down cost of care and be accountable for those outcomes, paid based on our success and our shared success with our patients is where we're heading. And we continue to build our capabilities in that area now with millions of data points from our partnerships and several hundred patients treated over the last couple of years. We also are very focused on being part of the community in the places where we're caring for people. That means taking advantage of the fact that we are a telehealth provider and can be a convener of really fragmented, disparate parts of the overall puzzle. So we partner with health systems, hospitals, emergency departments. They refer patients to us and know that they can close that loop and very quickly have someone onboarded into our care, and we'll let them know how folks are doing over time. Similarly, primary care, very important relationships for the patient, and a pretty robust care coordination process that lets us collaborate on care planning, make sure people who aren't in primary care but could benefit from it find a provider that they can trust, and often helping primary care clinicians refer into Boulder so that they don't have the kind of specialty care placed on their shoulders, but still know that their patients are being cared for in all of the ways that they should be, including behavioral health support, care coordination, and ancillary services that would be very hard to provide in a primary care setting. And finally, about 40% of our patients find us through word of mouth or provider referrals. So while some of our peers are very focused on digital marketing, we really look to the benefit of building these relationships over time as a way to continue to treat new patients in a way that's cost effective and over time, again, helps improve outcomes because of the holistic model that we're able to create by partnering with other providers.
Really exciting work to hear all that you're doing, Stephanie and team. Can you talk a little bit about what is your hope for the future of substance use care?
There's a long way to go for our industry, but I'm really heartened by the direction that we're headed. So I've been in this space for 7 or 8 years, and we weren't talking about value-based care or harm reduction or medication. And now all of these things are at the priority level of the federal administration, of all of our payer and provider partners, and in healthcare entrepreneurs. So I think we're heading in a place where hopefully people don't have to worry about whether they can afford care or where they can find it or how they can maintain it, and instead have choice and flexibility and can focus on recovery and on the most important aspects of their life. We know that this condition, like most healthcare conditions, isn't just about abstinence. It's not just about reduction in substance use, but about creating space for things that people love. So Boulder's model, and I think increasingly others in the SED treatment space, aren't just thinking about medication, but about what goals our patients are setting. Regaining custody of their children or being able to drive to work 3 days a week. And these are the things that we celebrate alongside our patients. And we hope increasingly payers, employers, and other partners will be reimbursing providers based on these success points. They're so critical, and healthcare isn't just about healthcare, but about wellness and total success.
Thank you so much for this important work that you're doing. Really grateful that we could have your expertise here today. Thanks for your time.
Thank you so much, Solmay.